Good morning. It's a pleasure to be here speaking at this excellent conference again. I'm going to talk about PAD prevalence and economic impact. First, some disclosures. The Sage Group is a for-profit research and consulting company. We sell our products and services to industry, the client list, and we do own stocks. These are the current holdings that might have any relevance to this discussion. In 2010, according to the diabetes method, approximately 17.6 million people had PAD. By 2015, we're estimating 19.2 million. Now, 18 to 19 million is a lot higher than the most commonly quoted 8 to 12 million. Why is that? Well, 8 to 12 million was an excellent number for the US population in 1995. Since then, the population has aged and become significantly more diabetic, especially those 65 and older. Note that the diabetes method estimates about 11 million for 1995. If we look at the US prevalence of diabetes, it's increased significantly, particularly in those 45 and older. If you look at this slide, on the gold bars are those 45 to 64, and that prevalence has almost doubled since then. It's about 16% now. In those 65 and older, it exceeds 30%, and that also almost doubled. If we look at the diabetes method, this is a real-time population-based method to estimate PAD prevalence by age, sex, and glucose categories, and for 3 glucose states. The glucose states are based on studies by Cowie and the CDC. The prevalence of PAD is based on the cardiovascular health study in those 65 and older. And for those 45 to 64, the prevalence of PAD is estimated based on the literature. Note that the US population prevalence of PAD in those 40 and over was a little under 13%. The rationale for this, diabetes is a significant risk factor for PAD. If you look at the population 50 years and older, 10 to 20% of them have PAD that don't have diabetes. However, those with diabetes, 30 to 40% have PAD. There are also numerous large-scale population-based studies that have been published in peer-reviewed journals that have examined the prevalence of PAD in many different populations, not just in the US, but worldwide. If we look at the prevalence of PAD according to other major chronic diseases, you see it's exceeded only by diabetes at 26 million. Note that PAD prevalence exceeds that of CAD by almost 1 million. Looking at PAD prevalence over time, from 1995, PAD has grown from 11 million to 17.6 million. By 2020, we're looking at about 21 million. By 2030, we're looking at 24 million. If we look at PAD prevalence worldwide, basically this epidemic follows the epidemic of diabetes. So we have 2 million in Canada, 4 million in Mexico, almost 15 million in South America, 23 million in Western Europe, and 16 million in India. The annual economic burden of PAD is between 164 and 290 billion. The lower figure is based on the per-patient costs in the US REACH registry. The higher figure is based on the Margolis Managed Care Study per-patient costs. These are inpatient and outpatient costs. The key difference between these two figures is that the Managed Care Study looked at all-cause hospitalizations, whereas the REACH study looked at cardiovascular and PAD hospitalizations only. Even at 300 billion, this understates because it does not include long-term care costs, especially those associated with critical limb ischemia. The majority of these costs are hospital. Between 62 and 87% are inpatient, or 102 to 253 billion in the managed care study. Of note, 2 Medicare studies also found that almost 90% of PAD costs were inpatient, and that compares with only 31% overall in the US healthcare system. Non-PAD costs are significant. If you look at cardiovascular hospitalizations only, about 43% are not PAD. However, if you look at all-cause hospitalizations, 90% of those costs are not related to PAD. If we look at one specific cost factor, that of major amputation, the cost there exceeds $10 billion. Who pays the PAD bill? Medicare and Medicaid pay 75%. In other words, your tax dollars. If we look at PAD patients in Medicare, between 7 and 10% of Medicare patients are treated for PAD. The per patient cost is between $25,000 and $63,000. And of note, above the knee amputation is the third most commonly performed procedure. At $63,000, the per patient costs for a PAD vastly exceed those for Medicare for Medicare average beneficiary at $9,800. If we look at PAD by severity, the vast majority, about 75% of PAD patients are asymptomatic. That is, they don't have the classic symptoms of intermittent claudication or critical limb ischemia, that is, rest pain, ulcers, or gangrene. Only about 15% have critical limb ischemia, and another 10% have intermittent claudication. So how much do these asymptomatic patients cost? According to the REACH study, asymptomatic patients cost about the same amount as symptomatic patients with intermittent claudication, around $6,500 a year. However, the reason for those costs is dramatically different. In the symptomatic patients, it's for PAD-related revascularizations and hospitalizations, whereas in the asymptomatic patients, it's for cardiovascular hospitalizations and revascularizations. Most PAD patients do not have PAD by itself. Only about 30% have PAD alone. The vast majority have some combination of PAD in conjunction with coronary and cerebrovascular disease. In fact, about half have PAD in connection with coronary artery disease. Polyvascular disease turns out to cost more. If you have PAD, it costs about $9,300. This is the REACH registry again. If you add another disease and another disease, by the time you have all three diseases together, the cost exceeds $16,000 annually. If we look at the economic burden of leg disease versus heart disease and stroke, again, the REACH registry at $164 billion, leg disease exceeds the cost of heart disease and is over 4 times the cost of stroke in this country. So the conclusions: PAD is a highly prevalent and a commonly underestimated disease. The macroeconomic cost of PAD is high. Hospital costs account for the majority of those costs. Hospital costs are significantly increased by cardiovascular and non-PAD events. And asymptomatic patients cost as much as intermittent claudication patients. And in 2010, the costs of PAD exceeded those of coronary and cerebrovascular disease. So my exhausted staff, we thank you.